Hello friends, I am Dr. Sukhbir Singh, plastic and cosmetic surgeon from New Delhi. Today we are going to talk about a very interesting and common topic, gynecomastia. Now gynecomastia comes from two words, gynec and mastia. Basically means whenever a male chest mimics a female, gynec basically means female, mastia means chest. So male chest, when it mimics a female chest, that means male has got a chest enlargement, or we say breast enlargement of the male patient. It is called gynecomastia. Now gynecomastia has got two components. One is the gland component, which is a permanent component, and one is a fat component. Now understand that everybody has some form of gynecomastia whenever in the teenager. That means 16 to 18, or maybe nowadays earlier 14 to 16, when they have a pubertal spurt, the tissues get enlarged. Okay, so gynecomastia is typically seen at 14 to 18-year age group. But by age of 21, it actually goes back to its normal architecture and structure. So if the structures or the gland persists beyond 21 to 23 years, that means it is a permanent thing. And gynecomastia, the gland component, especially if I talk about, is a permanent structure. So if it is there, it can be removed only by surgery, nothing else. There are a lot of reasons for it. The most common is a hormonal imbalance in the body. And secondly, nowadays what we are seeing very commonly is the gym proteins, which the people are consuming left and right. Most of the proteins, they contain steroids. It has been proven in a lot of studies which have been published internationally. They actually lead to your gland formation or pseudo gland formation, and even the fat becomes very excess. So even if you exercise too much, like if you go to a gym, they'll tell you, oh, we'll make you, we'll reshape your chest. Yes, you can reshape your chest. That means the fat component can be decreased or diminished with your diet and exercise. But if I talk about the gland component, it is a permanent component. It cannot be reduced by any format, whether you talk about diet, you talk about exercise, or any format or any medicine. Somebody promises you, please take these herbal medications or these herbal formulas. No, they don't work. Okay, so gland, if it is there, it has to be surgically removed. So what are the essential steps involved in gynecomastia surgery? So as I told you, there are two components, fat and gland. So the first step is we do a liposuction to remove the fat all around the gland. And sometimes in very early grades, we may just do liposuction and the small glands may be just taken out during liposuction itself. But in advanced grades like grade 3, grade 4, we have to have a proper liposuction and a glandular removal, which is a surgical method. Now, surgery for gynecomastia is a daycare procedure. The cuts are again very small. That means the cuts are around the areola, the pigmented area. So the scar is hardly ever seen. Like after 3 months, if I say, the scar is hardly seen. So again, it is a very safe procedure, quick recovery. Immediately after the procedure, we make you wear a pressure garment. Why? Because there's a dead space. You have to understand, the gland has been taken out, the fat has been taken out. So there's this much of dead space which is present. And for your skin of the chest to go back to its normal position, which was pre-pubertal, obviously there has to be a pressure, an equalized pressure, which has to be given to all the tissues for the effective result. So typically pressure garment is there for 6 weeks to 3 months. Now, when do we tell the patient to start exercise? So again, typically in gynecomastia, because the gland is very adherent to not only your skin, subcutaneous tissue, and also your underlying muscle. So there's something called muscle inflammation or muscle edema, which typically takes about 2 to 3 weeks to resolve. So we tell the patient to typically start their exercises at 3 weeks, and then gradually they can increase the exercise. So no swimming, no cycling, no heavy exercise or weightlifting for at least 3 weeks after surgery. After 3 weeks, you can go ahead and start graduating your exercises and increasing them level. Again, as I told you, it's a very safe surgery. Again, search for a board certified plastic surgeon to do your procedure to get the best effective result. Thank you for watching. I hope I've answered all your queries. Thank you.